All right, so what we're going to talk about now is a little bit of the peripheral nervous system. When we were talking about the spinal cord, talked a little bit about the spinal nerves. So what we're going to look at now is just the cranial nerves, a little bit more specialized when we're talking about cranial nerves in terms of function. A lot of the spinal nerves, they're paired, they're going to certain areas of the body, and it's really they're doing sensory and motor in both cases there. With the cranial nerves, they're a little bit more specialized, sometimes doing only sensory, sometimes only motor, sometimes a combination. But really what you need to know on these ones, their names, locations, and what they're doing. On the image, you can see the brain here. All these all these cranial nerves are the yellow structures coming off of that brain and brain stem. So here is the actual list. They are numbered. There's 12 different ones there. So you have number 1 is the olfactory, number 2 is the optic, number 3 is the oculomotor, number 4 trochlear, number 5 trigeminal, number 6 abducens, 7 is the facial, 8 is the vestibular cochlear, 9 is the glossopharyngeal, 10 is the vagus nerve, 11 is the accessory nerve, and 12 is the hypoglossal. There is ways to remember some of these ones, so you can kind of see some of the mnemonics here. Old Opie occasionally tries trigonometry and feels very gloomy, vague, and hypoactive. That is a way to remember all of them there. If you want to remember which ones are sensory, motor, or mixed, there is this one that is some say marry money, but my brother says big butts matter more. Sensory would be the S, M would be motor, B would be both. So if you can remember the first one and then the second one here, you can know what the names are as well as what their functions are. So again, this is pointing to all those ones there. Again, to me, olfactory nerves and the bulb, that's something that's doable. The crossing over here, that's another one I would expect you guys to be able to identify those ones. Outside of that, like I said, I don't generally go to these stumps and say, know this stump versus that stump. Again, probably one of the more important ones, especially as you get to the autonomic nervous system, is going to be that vagus nerve, number 10. So that's one that I would say make sure you pay attention to. So this is, again, pointing them all out, specifically highlighting just that particular one. Again, all the names again. So let's go through them one by one and talk about what they're doing. So we have one nose, 2 different nostrils. You have 2 olfactory nerves and olfactory bulbs. These are running from that cribriform plate. So if you remember in the skull, you had that crystal galli and the little olfactory foramina. This olfactory bulb is sitting on that, and those little holes are letting those nerves go through. So the olfactory nerve is a sensory-only nerve that is taking back the information from your nasal cavity to your cortex dealing with the sense of smell, which is going to be the temporal lobe, and again, dealing with that. You can see if we were doing a sheep one, the olfactory bulb actually tends to be a lot larger, but again, in the brain, this is sitting right on top of that crystal galli. The olfactory nerve is another sensory nerve. This is what's coming out of the eyeball. So remember the optic nerve leaving the eyes in AMP1. If we follow this back, it's going to go in a little ways and then it does this crossing over at what's called the optic chiasma right here. Generally, if you do a brain dissection, they've clipped it there and there so you can see the little chiasma that kind of looks like a hook 'em horns type of thing where it's crossing over. Again, damage to this nerve would lead to blindness if there's something to happen there. And again, you can see the optic nerves on this one. Kind of reminds me of Teenage Mutant Ninja Turtles and Krang, but you can see the 2 different parts right here. The optic nerves coming and crossing over. The oculomotor nerve is another one to me that is a very obvious one. If you go oculo, that's eye, motor is movement. So this is an eye mover. It is a motor only. This is dealing with the intrinsic as well as the extrinsic eye muscles, at least a chunk of them. The vast majority of them, honestly. So a lot of your eye movement, so where it goes up, down, left, right type of stuff, is dealing with a lot of those. So I'm not so worried that you know the exact muscles that it's affecting, but it is the inferior oblique, inferior medial, and superior rectus muscles. It also is controlling the iris as well as the ciliary body, the ciliary muscle that is controlling the lens. So again, another eye mover. The trochlear. There's actually 3 of these cranial nerves that are an eye mover. So the trochlear nerve is another one. This controls the superior oblique muscle. So you can see it's really just dealing with the top muscle right here. Can have issues with double vision if it's damaged. So again, another motor one here. I'm going to skip the trigeminal for a second and go to the abducens. So the abducens is dealing with the lateral rectus muscle, and again, motor only. So the oculomotor, the trochlear, and the abducens are your three eye motor nerves. The trigeminal is a mixed nerve. It's actually it's the largest of the cranial nerves as well. So it comes out of the pons and branches into three different parts. So you can see it right here. You have an ophthalmic that's going around the eye, a maxillary that's going up here, as well as a mandibular that's going down on the jaw, doing both motor info to chewing muscles as well as sensory info from kind of the face and forehead areas. Damage to this could lead to loss of sensation, inability to chew, inability to move certain muscles in the face. Again, very large one here. You can see the different branches and which branch is dealing with sensation where. So you can see that's the first branch of it, the middle branch, and then the lower branch on these ones. The facial nerve is another mixed nerve. So not surprisingly, going to the area of the face. So motor impulses to skeletal muscles of the face, not the chewing muscles. That is being done by the trigeminal. But a lot of the other facial movement muscles. Parasympathetic motor impulses to certain glands, so certain salivary glands and tear and nasal glands, as well as some sensory info from the back part of the tongue. The front part of the tongue, I said the wrong thing. So taking interior taste bud information from the front 2/3 of the tongue. The next one is the auditory vestibular cochlear nerve, or auditory or vestibular cochlear nerve. This is a sensory one here, bringing back information from the cochlea for hearing as well as from the vestibular senses. So if you remember our dynamic and static equilibrium sensors, this is bringing back things from there. So damage to this could be inability to hear, inability to stand upright, could all be issues with this one. The glossopharyngeal nerve is another mixed nerve, not surprisingly, considering on the side you see both motor and sensory functions. But this is coming from the medulla to the throat region. So motor functions, certain swallowing muscles, certain salivary glands. Sensory functions is a little bit of sensation from the throat and back part of the tongue, as well as some of those things that we would not be consciously aware of, like the chemoreceptors and baroreceptors that are dealing with oxygen and CO2 levels in the blood pressure. So in the areas of that carotid sinus is where we're seeing branches of this one. 10 is the vagus nerve. We will come back to this one. This is both motor and sensory again. Coming out of that the medulla, going down. It's the only cranial nerve that goes beneath the shoulders. This is motor function a lot to a number of different organs of the body. So digestive organs, the heart, the lungs. We are also getting sensory information back from those areas. Visceral sensation, so baroreceptor, chemoreceptor, as well as a little bit of taste bud from the back part of the tongue and throat. So vagus nerve is a lot. Like I said, we'll come back to this in the autonomic nervous system. Will be kind of important to us there. And again, you can actually see the picture of it running right next to the jugular vein in this one. Down to the last ones here, the accessory nerve. Like it says, our unit of the cranial root and the spinal root here. It is a mixed nerve. So cranial diversion, like it says here, joins the vagus, innervates the voice box, the pharynx, and parts of the soft palate. Another part of it goes to the sternocleidomastoid muscles. So, it was a motor nerve only. Sorry, I said the wrong thing. So this one, again, doing neck movements as well as some of the throat. And finally, the hypoglossal is another motor only, going from the medulla, innervating the tongue, so intrinsic and extrinsic muscles of the tongue, so things that would be involved with swallowing, speech, chewing foods, are what we would see with the hypoglossal nerves. So again, to me on each of these ones, knowing what the cranial nerve does knowing its name, and again, sensory motor mixed. So name, location, function. That's really what you need to know on these ones. Again, not going to give you 30 questions on this stuff. It's just knowing some of that.